everyone. So I'm Coach Jess, and today I want to talk about something that often gets overlooked, but I think is arguably one of the most important factors for your digestion to run smoothly. That is stomach acid and enzyme production. So if you're watching this, you might be dealing with low stomach acid or low enzyme production, and you probably have a lot of questions that are about to be answered. So let's just dive right in. What exactly is stomach acid? So, it's one of the first steps in the digestion process, and it's essential for a lot of different processes to function optimally in our digestive system. So, stomach acid helps signal other digestive juices in your stomach and intestines to get to work and begin to help breaking down the food. Beyond that, it also plays a huge role in your immune system. So it's like the first line of defense against toxins and infections that enter your digestive tract through food. Without enough stomach acid, it's you're not able to kill off harmful bacteria and viruses effectively. So this is why if you ventured down the rabbit hole of learning about stomach acid, you may have heard that one of the biggest factors for H. pylori and SIBO is low stomach acid. So, stomach acid is also crucial for breaking down food, especially protein, which is one of the hardest macronutrients to digest. If you're not digesting your food properly, you're not absorbing the nutrients that your body needs. So, think iron, zinc, B vitamins. Also, think about the supplements you're using as well. This is why supplementation isn't the end all be all for improving gut health, because if the root of your issue is low stomach acid, that needs to be fixed before you start digesting and absorbing your food and even your supplements properly. So, I want to talk about why your stomach acid might be low. There's a few major causes. The number one thing I want to talk about is stress. So, stress specifically downregulates stomach acid production when you're constantly in that fight or flight go mode, your body isn't going to prioritize digestion. It's going to prioritize fighting off the bear over here. And chronic stress can also deplete your mineral stores, and these are necessary for producing enough stomach acid. Another biggie is undereating or overexercising. If you're not eating enough, your body just thinks it doesn't need to produce enough stomach acid or any stomach acid at all. And over can also lead to the same problem by putting your body under a lot of stress, which we talked about above. Another cause could be H. pylori. So this bacteria specifically damages the lining of your stomach and reduces acid production. It's a common infection. 1 in 10 people have it, and it can even lead to ulcers as well. And that's also the first infection I had, which was pretty severe, but everyone experiences different symptoms. Another cause is nutrient deficiencies. So, if you're low in key nutrients like iron, zinc, or B vitamins, your body doesn't have the tools it needs to make enough stomach acid. Another cause would be age. So, as we age, stomach acid production just naturally decreases, which is why older adults usually struggle with a lower appetite and digestion. Another cause is medication. So, things like PPIs, which are proton pump inhibitors, and antacids neutralize stomach acid. While these medications help with heartburn short term, long term use can usually create a much bigger issue by lowering stomach acid even more. The last one is surgery. So this is surgery that specifically interrupts the GI tract. Common symptoms of low stomach acid would be bloating and gas after meals, indigestion or even discomfort, especially with protein-rich foods, heartburn or acid reflux. So it actually might mimic high stomach acid symptoms, which is something that we need to be cautious of. Nausea, or if you feel full really quickly, like after a couple bites of food, undigested food in your stool, this it would be more frequent. Of course, you may always see corn or seeds, but this is seeing frequent and a lot of undigested food in your stool. Nutrient deficiencies, especially B12, iron, calcium, magnesium, and zinc. This is something that we can see on your blood work as well. Frequent burping, bad breath, fatigue or weakness, mostly due to poor nutrient absorption, chronic gut infections. So this is like an overgrowth of bacteria or yeast infection. So think SIBO or Candida. If you are constantly getting infections, that could be a symptom of low stomach acid. Hair thinning or brittle nails, and then skin issues such as acne or dry skin. So, if you are experiencing some of these symptoms, here are a couple things that you can try right now to support you. So after meals, try and stay upright for 1 to 2 hours, and this is going to help prevent reflux. Eat smaller, more frequent meals throughout the day. And I would say avoid eating large meals before bed. So if you can, I would try and avoid food a minimum an hour before bed. Another is chew your food into a fine pace. So think 15 to 30 chews and eat slowly in a very relaxed environment. This is a reminder that chewing your food properly initiates more stomach acid and more enzymes to help break down that food. Go for a light walk after meals. This just is going to help get things moving in your digestive tract. Avoid trigger foods. So, chocolate, caffeine, garlic, onion, alcohol, and fried foods are the big triggers. I would focus on whole, colorful foods. Cook your veggies until they're really soft, which makes it a lot easier to digest. Reduce your stress. So, both mental and physical burden on your body. So, this is going to help lower inflammation in your body. The last and most important is just test and don't guess. So, get evaluated for low stomach acid, SIBO, or H. pylori, and keep in mind that we can also evaluate stomach acid levels through just basic blood work without having to do any advanced testing. Okay, so stomach acid is just one piece of the puzzle. So another key player in your digestion is pancreatic enzymes. These enzymes specifically help to break down fat, protein, and carbs. And when enzyme production is low, food just doesn't digest properly, and you can end up with range of GI symptoms. So constipation, bloating, nutrient deficiencies, a lot of the ones that I have discussed. Here's how low pancreatic enzymes can lead to constipation, which is a common symptom, maybe even the most common symptom that I see with my clients every day. The first thing is incomplete digestion. When pancreatic enzymes are really low, your food isn't broken down well. This can cause a fermentation and slower transit time in your gut, leading to constipation. If you're low in lipase, which helps break down fat, you might notice greasy or fatty stools, which is talked more about in the liver PDF, and this can also cause irregular bowel movements. So when food isn't digested properly, it also moves through your gut a lot slower, which again can lead to constipation. The other thing is nutrient deficiencies. Without enough enzymes, you can't absorb the nutrients you need. This can further weaken your digestive muscles and slow down your digestion. The last one is an imbalance in pH, which can interfere with digestion and create a much less favorable environment for smooth bowel movements. I just want to cover a summary of the dietary strategies that I've been discussing because I've been talking about a range of them throughout this video. But my first one is eating smaller meals to reduce the digestive burden more frequently throughout the day. So every 2 to 3 hours. Chew your food into a fine pace. So think 15 to 30 chews, depending on the food, of course. Eat slow and in a relaxed environment. So I always think like monk mode. When I'm eating, I take a few big deep breaths. Remember to chew. Remember to just not be working and try and be in the most relaxed environment that you can be. Focus on well-cooked and easily digestible foods. Just if you're unsure, but lean proteins like white fish, ground meats, and cooked vegetables. Other really digestible foods would be white rice. I like cooked and peeled potatoes as well. Another strategy is staying hydrated. Drink enough water, add electrolytes. This is going to help keep things moving in your digestive system. Opt for gentle soluble fibers. So this is going to ease constipation. Think about avocado, sweet potato. I always peel my sweet potato and I also steam it as well. Bananas and blueberries, any berries for that matter. Limit your intake of processed foods, alcohol, and caffeine. Include anti-inflammatory and antioxidant-rich foods. So I like to think about the Mediterranean diet, but with a little bit more protein. So berries, fatty fish, lots of different nuts, ground seeds, dark leafy greens, olive oils, coconut oil, and things like this. Digestive bitters can also help stimulate enzyme and bile production. So I usually have bitters, I'd say 15 to 20 minutes before a meal in a little bit of water, and it can help stimulate that enzyme and bile production. Here are a couple supplements that we use with our clients. However, I would master what I just listed because those are things that you can do right now. And then I would consult with a practitioner before adding the following because it can do more harm than good if not used appropriately and if not using a good brand or a quality supplement. And enzyme supplements like pancreatic enzymes. So I look for amylase, lipase, and protein. And then probiotics. So this is to restore your gut balance. I have different recommendations based on if you have diarrhea or constipation-like symptoms, so reach out if you have any questions. Lastly is betaine, HCl, or ox bile. So this is going to support digestion, but I would make sure to check with your doctor or dietitian first because HCl specifically can do more harm than good. Even we are very careful when we are adding HCl with clients. For example, if you have H. pylori or ulcers, this can aggravate them and make them a lot worse. So yeah, again, I'd say avoid HCl or bile supplementation until a practitioner or a dietitian has done a full assessment and workup on you. In summary, low stomach acid and enzyme production are often overlooked and is a big cause for digestive issues like constipation, bloating, nutrient deficiencies, among a lot of the other GI symptoms that I've mentioned. With the right testing, diet, and supplements, you can support your digestion and feel better. And if you're struggling with any of these symptoms or have questions as you implement the different strategies that I've just talked about, please reach out and we will talk more. So thanks so much for watching, guys.